Plantar fasciitis is irritation or inflammation of the plantar fascia caused by small tears on the ligament. It is caused by anatomical, biomechanic, and environmental factors such as obesity, flat feet, high arched feet, shortened Achilles tendon, weakened muscles, walking barefoot, prolonged weight bearing, inadequate stretching, and wearing poor footwear. The plantar fascia ligament absorbs as much weight as a fully loaded cement truck. According to PubMed, plantar fasciitis is more correctly termed fasciosis because it's typically chronic and the tissue eventually degenerates. Signs and symptoms include pain in the bottom of the heel, which is more severe in the morning after taking your first few steps. The pain is more severe after periods of inactivity and after carrying weight, heel stiffness. The diagnosis is based on your medical history and a physical examination. Your doctor may recommend an X-ray or MRI to be sure another problem, like a stress fracture, is not the case. Plantar fasciitis affects the plantar fascia ligament in the foot, where small tears in the tissue cause inflammation and pain. If left untreated, it can cause pain in the knees, hips, and back, since most patients try to compensate for their pain by changing the way they walk. Plantar fasciitis is not life-threatening, so one can live a normal lifespan. Daily life is accompanied by heel pain, especially in the morning after waking up. Treatments such as stretching, shoe inserts, wearing supportive shoes, icing, and physical therapy are part of daily life to manage the pain. There are initial treatments that are patient-directed. Secondary treatments are physician-directed, and tertiary treatments include seeing a specialist. Initial treatments include stretching, massages, icing, non-steroidal anti-inflammatory drugs, and shoe inserts. Secondary treatments would include taping, physical therapy, night splints, corticosteroid injections. These provide short-term pain relief for at least a month in most patients. However, it could cause further injury like the rupture of the plantar fascia or fat pad atrophy in the foot. Extracorporeal shockwave therapy is also another option. It is non-invasive and there are fewer complications compared to surgery. But it is very expensive and is not covered by most insurances, and it only helps a fraction of patients. Surgery, such as a fasciotomy, is for the remaining 5% of cases that do not respond to more conservative treatment methods. It has a high success rate. However, the cons are that there's a long recovery time, it's expensive, and there is an increased risk of infection. In order to prevent plantar fasciitis, maintain a healthy weight. Don't walk barefoot on hard surfaces. Wear shoes with good support. Do low-impact exercises. The prevention methods place less stress on the ligament, so it is less likely to micro-tear. Plantar fasciitis usually resolves in 6 to 18 months without treatment. With 6 months of consistent non-operative treatment, people with plantar fasciitis will recover 95% of the time.